Okay. Hello, everyone. My name is Emily Lee, and I'm the Marketing and Promotions Manager over at the Santa Barbara Independent. Thank you so much for tuning into today's Downtown Business Spotlight. Downtown Business Spotlight is an interview series hosted or co-hosted by the Santa Barbara Independent and Downtown Santa Barbara. And it's a series where we highlight different Santa Barbara business owners so you can get to know them a little bit better, and so we can also get to know them a little bit better. We are recording this conversation, and it'll be up on both independent.com and downtownsb.org, so you can look at the show afterwards. Also, all of our previous episodes are on both of those sites too, so if you missed any of the previous 45, I think we're on 46 today, so if you missed any of them, you can find them all on those websites. Also, if you have any questions for any of our guests, just put them in the chat and we will work them into the conversation. And I think that's it. So without further ado, our host today is Robin Elander. Robin is the Executive Director of Downtown Santa Barbara. And I've just been so happy to host the show with her each week. So with that, I will turn it over to Robin.
Okay, thank you so much, Emily. It's been a joy to be co-hosting with you on this show for now 46 episodes. And today we're going to be talking about active aging. And so such an important topic. And we have two incredible guests. And I just found out some interesting factoids before the show, and that the Family Service Agency has been here since 1899. And the VNA Health has only been a few years after that. So we're going to start with Lisa, because 1899 is quite an accomplishment. And so welcome, Lisa Brabo from the Family Service Agency. Tell us a little bit about yourself and about Family Services Agency, or Service Agency.
Absolutely. I can't say that I was here in 1899 when it all started, but I can tell you that some of the first things that the agency did, they provided milk to low-income families, wood, they helped with employment, they helped with the things that the community, that the people in the community needed at the time. And I can say that through the next, 100 and some years since then, well over 120, we have done exactly that. It's like we keep shifting what we provide to the community based on what the current needs are. So that we have a very consistent thing throughout has been basic needs. We don't any longer provide milk or wood, but we do, for example, help people with food and clothing and economic help. I can say that during the pandemic, for example, we have partnered with a joint response effort, and we have been processing applications for rental assistance so that people are able to, can catch up on their rent and be able to stay where they are. And that affects all ages, of course. This particular program is on aging, active aging, and within our agency, what we provide right now for older adults are mental health counseling. And you can just imagine the need for that now, given everything that folks have been through during the pandemic. And I can say a lot more about that later, for sure. We also provide support to caregivers. It's been quite a difficult journey for caregivers because a lot of the support that they relied on before was shut down during COVID. And we provide case management. In other words, we help elders and caregivers connect to resources, because a lot of times there are resource needs. We also operate the long-term care Ombudsman program. These are the folks that go into long-term care facilities like nursing homes and monitor the care of residents. And you can just imagine all the challenges involved in that during this time. So that's an overview of what we provide for seniors. We used to operate the Senior Expo. Perhaps you heard of that. That's where 1,000 seniors and caregivers would come to a big building at Earl Warren Showgrounds and get connected to resources, as well as get their flu shots. We haven't done that for 2 years now, that we're hoping to pick that back up again in the future.
Well, I definitely want to hear more about your organization, but first I want to hear a little bit more about you. Tell us about yourself. Are you from this area? How did you get into this role, and how have you kind of made this your passion?
I have been in Santa Barbara for 7.5 years, moved from East LA County, also executive director of a nonprofit there. My whole career has been working with nonprofits. And I'm one of those people that had kind of an event happen when I was young that got me into this arena of nonprofits. I spent a lot of my growing up years on an Indian reservation in Montana. And we went to school there, we lived there, it was a very wonderful experience in a lot of ways. And what I also saw there very clearly was the racism against Native Americans and the lack of resources, the lack of hope of a lot of the kids that I was going to school with, the lack of hope of a lot of the Native Americans on the reservation. And from that experience, what happened in me is I sort of got a fire built inside of me. It's like, things have to be able to be better than this. They just have to be able to be better. It was so not good, what I saw all around me. But that's what got me into the nonprofit arena. I've been doing it ever since. I started working in domestic violence, sexual assault programs in Montana and then in Wyoming. Then I moved to Colorado and started working with aging issues. Was director of the Area Agency on Aging there. I like to get around a bit. So then I was like in Boston, and then I went to Wisconsin, working with low-income families primarily, and then came back to California and started working with families and seniors who were experiencing homelessness. And eventually got up here to Santa Barbara. So I'm one of those people that is passionate about equity, people having equal access to resources, being able to make choices in their lives that are good for them and their families. And that's really what drives me here at Family Service Agency.
Wow, Lisa, what a career of service. That is really incredible how much you've been able to do. And also, we're so thankful that you are here in Santa Barbara doing this very important work. So thank you. We're going to come back to talk to you a little bit more in a moment. Mary Beth Gomez, welcome to the show. I'm so excited to learn more about VNA Health. Tell us a little bit about yourself and your organization.
Okay, well, yeah, thank you for this opportunity. Great to meet you, Robin. So I have been a nurse my whole life. That's kind of my story. I feel fortunate that I fell into a career that I love and is such a passion of mine. Thinking back after listening to Lisa, how I got into nursing, I had an aunt that I really admired who was in healthcare. And I'm like, I'm going to be just like her. And I just followed that inspiration and have loved nursing and everything I've done in nursing all my life. And I fell into this agency sort of by accident, actually. I came here to do flu shots like 27 years ago.
Okay.
One winter. I was only working 3/12s at the hospital and I had 4 days off. It's like, what am I going to do? So I started doing flu shots, and then of course, that comes and goes, and VNA did a lot of flu shots in the community. We set up little shops all over town, and then they said, oh, do some visits for us. And I did some visits, and then all the history started right there. And then I've had different positions in the agency, and I'm the home health director presently at VNA Health. And I just love what we do for the community. So that's my short career is really just nursing.
Well, that's a whole lot of
mostly in Santa Barbara. I've been here
and
for 30 years.
That's
So,
incredible.
yeah, fortunate to be here and to have the opportunities that Santa Barbara has. So we'll talk a little bit about VNA Health, what services we provide, but I just want to kind of piggyback on what some of Lisa said. So much of what Family Service Agency does in VNA Health, we really complement each other, and really proud to have them in our community as well, serving the underserved and helping with all the diversity in here and bridging people to resources is it's really at the really base of what we do. And Family Service Agency really supports that as well. We have obviously much more of a medical component, So I'm really proud of us being able to share these resources together. But at VNA, which started in 1908.
That's so incredible that both of your organizations have been around that
Yes,
long for our community. That's, I mean, obviously these things are such an important part of our society that even back then it was shown that it was needed, and now it's still going. So tell us more, Mary Beth.
Yeah, so it's interesting because coming full circle to what we are experiencing nowadays with the pandemic and infection control and disease prevention, and that's how VNA started, was helping people with infection control, helping to manage families in their homes, children, and all the services that we still do today. Obviously, it looked very different then with a nurse and a horse and a buggy, but you know, that's what we did back then, helping to prevent disease. You know, there's many diseases throughout this past, you know, 100 or so years that we've gone through, tuberculosis and influenza and different diseases and viruses that we had to help with. And that's what we're doing right now today. So our current services, very medically based. So we have a home health program, which primarily is there to help empower and help people get better after illnesses, a surgery, maybe an exacerbation of a disease, teach people how to care for themselves so they can stay healthy and be at home. We also have hospice services, which helps people at the end of their life and supports patients and families, caregivers, for people who are in the last 6 months of their life. Part of our hospice program, we have an inpatient hospice house called Serenity House. Some of you may know of that or have been there. It's an 18-bed facility that's here in Santa Barbara, where patients can be 24 hours a day. They live there, have round-the-clock nursing care and support care. The families can visit them, their loved ones. We also have a palliative care program, so helping to serve patients who have palliative care needs, pain and symptom management. So they help support patients with our home health team primarily. We also have our loan closet services, which we have equipment that people can borrow at no charge, mostly things like walkers, wheelchairs, canes, all sorts of gadgets over there. And what we ask for is people return them after they use them so that we can give them back in the community. And after people have used them, they bring them back. And we can help keep turning them around. Most of that equipment people need for such a short time. You know, they've had a surgery and they need something, and what are you going to do with that afterwards? So that is a great program that's actually funded by our foundation. It's just so nice for our community. Also, I do want to just discuss a little bit about each of our medical models with home health and with hospice. We have RNs, LVNs. Home health also has a full complement of other professional services with physical therapy, speech therapy, occupational therapy, social work, and we also have home health aides that help people with personal care. And hospice also, all those services are also within hospice. They have a lot of social workers in hospice care, and then they also have a bereavement team that helps families after they've lost their loved ones. And they also, our bereavement team also has programs and will support the community. Sometimes in times of our disasters we've had, helping support communities or programs, other businesses. So that's a great resource for our community.
Wow, absolutely incredible resources for our community. Those, your team must just be so full of heart. There is, I mean, there's so much being offered there that are critical to support families and their elders, or just people who have had an accident that need to recover. Well, thank you for sharing all of those interesting things. I want to talk a little bit about how life has been for this past year for both of you. You're really your organizations are playing the kind of social net, critical services that are kind of taking care of, you know, people at all levels of society, but certainly those that really need the care. And I want to start with you, Lisa. Can you speak a little bit about how things have been going in this past year. We're in the middle of one interesting moment in time, and you're personally and professionally and organizationally stepping up to the challenge. So how's it been going?
What a great question. I think we probably all have lots of responses to that question. I did want to thank Mary Beth for all the great work that VNA does in the community. I agree, we're a wonderful complement to one another. So we've been really looking at things through two lenses, maybe. One lens is what is it that the community needs? And then the other lens is how can we support our staff so they can help provide what the community needs?
Right.
It is a two-pronged effort for sure. We have staff all over the county, and shortly after the pandemic started, we actually implemented weekly all-staff meetings via these wonderful Zoom tools that we all have now.
Now we know them well.
Yes. We have about 230 employees. And one of the things that has happened over time, over these many months now, is we've built a lot of trust with each other, our staff across the board. And they've been very forthcoming with two things. One is what are communities experiencing, including them, their families, their neighbors, the clients that we serve. And then the other very common topic for us is what are the challenges that they're experiencing in being able to continue working and really meeting their family needs as well as their own needs. So we've been balancing both of those efforts. And you can imagine, in the community, seniors and other ages as well, it's a couple things. It's basic needs. For seniors, it's been food, it's been prescriptions. Isolation is huge. That's a very, very big issue. The digital divide has been tremendous. A lot of older adults don't necessarily know how to use the technology that younger people know how to use, and that has then been isolating for them, and they haven't been able to access resources as easily, perhaps, shall we say. And then we've had caregivers who are caring for older adults who, maybe they used to take their loved one to a daycare center, or maybe they used to have someone come in the home and help out. A lot of the resources that were available pre-pandemic, in the beginning of the pandemic, simply weren't available because people couldn't provide them. So that put tremendous stress on caregivers. As folks who are caregivers know, it can be a very stressful situation and joyful as well. So that's the service side of what we've been working with there, trying to address all of those issues. On the staff side, what we found is staff were overwhelmed, of course, they've got kids at home who are trying to learn, they have their own perhaps caregiving situations, they have their job that they're trying to carry out. So we put a strong emphasis on self-care for staff and increased our supports for them. For example, we opened up childcare at all of our offices for staff so that they could be there with their kids. We had childcare providers as well. They could do their jobs during the day, and their kids were well attended to, had a good place to be, so that they could have a reasonably balanced life in the middle of all of this stress that everybody has been experiencing. So what we've been emphasizing is service in the community, support for staff, and also increased communication across our agency and with people in the community so that we could be quick and responsive regarding needs. I will tell you that we did start a special project during the pandemic. We called it the Isolated Seniors Project. And it included service providers and funders alike. We actually had a funder approach us about their concern about seniors being isolated during the pandemic, and their desire to actually pay for some additional assistance for them. And at that time, a lot of providers had shut their services down because that was the best option for them. So we actually contacted providers in every community across the county. We had individual community meetings. We figured out who was still open, who could try to help meet the needs of isolated seniors. And then we worked together with a whole group of funders to pay for additional assistance. And the first part of that assistance was simply reaching out in each community and trying to find those isolated seniors. And then doing an assessment with each one to figure out what they needed. And a lot of times it was basic things like prescriptions, food, etc. Sometimes a lot of them really appreciated mental health support, so they had someone to talk with on a consistent basis. So we worked together as organizations across the county, for the first, 10, 12 months of the pandemic. And then we rolled off those services to longer term help for folks. But it was a tremendously successful partnership across the county. Helped about 1,200 older adults and caregivers, and I think has really made a big difference during this time.
That's really incredible how you've not only seen a need, addressed a need, and tried to, bring all of these different agencies and also philanthropists towards this effort. That, a lot of good work is being done there. So congratulations on that. What are your geographical service area? Is that Santa Barbara County, or do you go into other counties? Is it more in one section of the county than others, or can you speak a little bit to that?
Yes, we are close to countywide. We do provide services in Guadalupe, Santa Maria, Lompoc, South County as well. We are not so much in the San Ynez Valley, and only limit some of our services are in Carpinteria and Goleta. So pretty much countywide. In the last 4 years, we have merged with a couple other organizations. The first was the Santa Maria Valley Youth and Family Center, and the second was the Guadalupe Little House by the Park. So we have a very strong presence in both of those communities, and always have in the other communities as well. So our services are definitely readily available, and people can contact us via our website or phone. I'll put those in the chat for folks. Even if you just have questions about assistance, we're happy to either provide it or connect you with the people who can. So. Oh,
great. And maybe just verbalize some of your website, just so that if someone isn't with us live, that they will know where to go there.
Great idea. Thank you. The website is fsacares.org. It's English, Spanish, and we have some audio for Mexico speakers. And then our phone number is 805-965-1001. That's 805-965-1001.
Excellent. Well, thank you so much for that, Lisa. We'll come back to you with a few more questions about your agency, but thank you for sharing all of that and all that great work. Mary Beth, what about you? How have things been going during this past year? Tell us about your personal experience and about your organization.
Yeah, it's been a challenging year. But it's great to be here for people to serve our community. It's just amazing. I'd say one of our biggest strengths has been our public health department. The Santa Barbara Public Health Department has been such an ally, and the guidance from them has helped us tremendously. So it's a great partnership we have with them for both support, also supplies, some of our PPE, personal protective equipment, as far as thinking about masks and gowns and gloves, and there was such a shortage early on in the pandemic. It was hard to acquire some of those, these vendors were just charging, oh my gosh, 3, 4, 5 times the amount for supplies. It was crazy. So thanks to our public health department, because first we have to care for the people who are caring for others. We have to support our staff, and unfortunately we couldn't open up a daycare center like Lisa was able to do at Family Service Agency. That would have been a godsend. But those challenges to support our staff with the needs during especially the early part of the pandemic, when kids weren't all of a sudden not in school, all of their support teams were taken up with either people are sick, have COVID, can't this, can't that, and their work's important. So that was a real challenge for us in the beginning. We had to make some accommodations, and our agency is 24/7. So we work 365 days a year, 24 hours a day. So a lot of staff have been very flexible. Sometimes they could work on other days. Maybe someone in their family was home. They could alter their work schedule. So that was helpful. We could accommodate that. We were able to accommodate some staff being able to work from home. So that was a huge shift for us. And I think a lot of companies, everybody comes to the office every day, these hours, you work at this desk, you have meetings in a boardroom. Well, that changed. And really proud of our organization and our IT department and human resources to be able to help structure that so that we could all keep doing our job, so that we could serve the community. Of course, our staff, our nurses and clinicians and the therapists who have to see patients, protecting them and supporting them. That was one of my main jobs, especially in the home health department, making sure they had the appropriate equipment to wear so they stayed safe. And be able to bring that care to the patients. And I feel really fortunate that we've been able to do that for them. I think home health has grown so much over this past year because the need is there. As many of you may have experienced, first doctors weren't even seeing patients in the office. I remember those very early phone calls back in, earlier last year. Doctor's office is calling going, can you see my patient because I can't see them? And I'm like, we're like, well, of course we can. And it just made me realize like, wow, I didn't think about how much that would affect people. And it's just really opened the doors for patients and for us to be able to go out in their homes. I also just want to touch on, at least was mentioning about the geographical area. I didn't mention, we're up all the way through Santa Maria. We also have a branch office that's in San Ynez Valley. So we serve the Lompoc and San Ynez Valley and up through Santa Maria. So we're pretty much in the whole county here now, which is wonderful. And reaching out in all the services we have in Santa Barbara, the same services I described are also up in our North County. So we found really creative ways to keep reaching out to people. We have telemedicine available. So we have their iPads and we can do video conferencing with people. They can be checking their vital signs. There's education built into that system. So that was one nice way to stay connected with some people. Also using FaceTime. A lot of things changed in the pandemic where there's waivers where it was okay to do some of these things, where before, because of HIPAA compliance, we had to be a little more careful. Not that we're still not careful, but some of these other things were allowed to stay connected because of that disconnect and isolation was a huge problem. And think about people in facilities, not being able to have their loved ones visit. So that was a really, for some patients in the facilities, mostly our hospice patients, that was a real challenge. So iPads but yet again, we needed people to help them with the technology like Lisa touched on. I know in the home health care side, we were able to augment that for patients and have our nursing staff or physical therapy staff while they're making a visit to connect patients with their doctors, with their Zoom meetings, or if it was FaceTime, or even if it was just for an audio call, because people still needed to see their physicians or their providers. And I was able to participate in some of those, and it was really, really beneficial on both sides. It was just great. Families were so appreciative. Doctors were happy. That was wonderful. And I don't see that changing that much going forward. I think this technology is going to be here to stay.
Oh, well, that's great to hear. I was going to ask you exactly that. That sounds like such a big shift in the healthcare system and such a benefit to both the individuals who are getting the care, but also the doctors, and just to be able to access more of that in the moment. So I'm glad to hear that you think that will be staying. What else do you think will be are some of the learnings and takeaways from this that you think might be staying from this unique situation?
Yeah, I personally think, our world has changed forever. I don't think we're going to ever go back to the way everything was. I mean, we want some things the way they were. I do hope that everybody's not too scared to be together again at some point. I mean, that's been challenging for families and friends and patients and everybody. We've had patients say, I don't want anybody in my house. Don't come and see me. We're like, yeah, but we can do this. We protect ourselves. We'll see patients outside. We live in a community that we're so fortunate to have beautiful weather, 99% of the time.
Mhm.
Some patients are so afraid to have people near them, but hopefully, I hope we get past that. But I think that we're going to come out, be more resilient. Hopefully, everybody will be more conscientious about infection control. I don't think that that's something that we can ever take for granted, not that we ever could. As somebody at my work who reminds me, this is how Florence Nightingale started. She talked about infection control. Wash your hands and look at everybody gets better and open the windows. It's so basic and it's so true. And it's like, I think in our wonderful modern world, we take so many things for granted, people traveling and doing this and doing that and everything. We have to be really mindful. And I think technology has, with the growth of that, even in our little agency here, it's been tremendous what we can do to support people to work remotely and keep providing the care we do. We didn't miss a beat. Our people from billing, medical records, everywhere across the agency is working. And it's amazing what you can do. Like you didn't know you could do until you had to do it.
That's right. We were all forced to figure out new ways to do different things and just figure it out. And so it sounds like your agency really has figured that out and continues to push forward under, these changing conditions and, taking away some of these learnings that will change the course of healthcare potentially forever. So that's really exciting to be able to support people in this way. Can you speak just a little more to the people you are supporting, who is utilizing your services and how they can get started with utilizing your services? How does that process work?
So the primary population we serve is the aging. We are a Medicare certified agency, and one of the qualifications for most insurance is that people are homebound. They can't be easily accessing healthcare outside of their home, or insurances they think they should be going to outpatient, not having home health. So generally it's the older population. Although with that being said, you can think about younger people with accidents or surgeries, and we serve all ages. And the way we start our services is through physician orders. So we do need a doctor's order for all of the care that we provide. And that can be initiated, by the physician's offices. It could be initiated when they're in an inpatient setting and going home, or they can call us directly. If somebody has a need or has a question, they can call visiting nurses and say, I need XYZ, and we can call the doctors for them and get their orders. So it could be phone called. I can give you the phone number.
Yes, please really give us the website and phone number. Yes, please.
Yes, we are at 965-5555. That is one number that's easy to remember. And you can reach all of our services and contact us through our website at vnahealth.org.
Very good.
Yeah, there's lots of information on there and resources, events, careers, everything.
Well, beautiful. That is amazing stuff. And I want to come back to you just a little bit more. Lisa, tell us more about the people you're serving, but also how your organization is funded, because you're doing a lot of this important work and we need to know how you're getting this money. And I know that you're a nonprofit, so that often it has to do with donations. I want to make sure that we know the community knows how to support you, and we'll chat a little bit about that too with you, Mary.
Sounds good. Thank you. So a little bit about who we're serving. We work with anyone who's 60 years of age and older for our senior services program. We do provide mental health counseling, and what we're seeing a lot there is people feeling anxious and depressed and afraid and isolated, of course. As I think all ages have experienced all of those things, not particular to this population. For caregivers, when we're talking about caregivers, you can add a couple more things. We're seeing sort of what people express as a loss of self, because a lot of who they are is going into caring for the older person. Maybe they're feeling some burden and anger along with the anxiety and depression. So with mental health counseling, we can work through those things because there are obviously lots of rewards and joys with caregiving and aging, and we can help people with the tools that they need to feel better about what their situations are and to cope better with them. The long-term care ombudsman program is a really important one because it does support residents in long-term care facilities. During the first part of the pandemic, we weren't able to go into the facilities because of obviously the quick spread of COVID. So we were working even more closely with their family members and connecting with people via phone and FaceTime, as Mary Beth said, and other virtual ways, so that we could still connect with residents and facilities and hopefully connect their families, connect them to their families as well. And that's obviously a particularly vulnerable population. And I think Mary Beth's, population, the VNA population of folks who are homebound, it's a similar kind of scenario. And way to go, VNA, for serving people through this entire time. I know that hasn't been easy. And then we provide case management for folks who may have been victims of a crime or abuse. We partner with legal aid on this program, so we help people restabilize. We help them with whatever legal issues through legal aid that they may have, and then we help them stabilize emotionally, physically, etc. So that's how we're serving across the county. How do we support ourselves? We receive a fair amount of public funding, and that's at all levels, from city all the way through the federal government. A lot of our funding is through the Older Americans Act, which comes to our local area agency on aging and then comes to us as a grant. And then we have private funding. So the private foundations and individual donors are huge, very, very important to supporting these efforts. What happens with the public money is that it's wonderful, it's stable, and it's very specific about what it will support. It's very specific. And the private funding, the foundations and individual donors, what that funding allows us to do is to meet additional needs so that a whole continuum of assistance can be provided for folks. So you're not just going in and doing what the public money can do, but then you've got some private money to support the other needs that people have so that they can truly stabilize and have good quality lives. So we really do depend on those, that private funding coming through and donors, and thank you for the opportunity to talk about that. That's very kind of you to provide that.
Absolutely. What are some things that private donors have supported in the past?
The whole Isolated Seniors Project was all private money, if you can believe it. It was all private funding. So it supported things like literally door hangers. We went out to neighborhoods and put door hangers on doors. And that was the best outreach that we did. It was very effective. And who would even think of that these days?
Great.
They also supported additional meals, and they supported staff who literally ran prescriptions back and forth or contacted, pharmacies and got prescriptions delivered. Private funders have also supported additional supports for caregivers. We don't have near as much public money for caregivers. So it's been things like support groups for caregivers, for example, that are beyond what the public funding will provide. And we have continued those support groups via virtual means. The older population is very conversant on the phone. That is a piece of technology that they are really good with, and actually way better than younger people. So that has worked really well as far as the individual counseling and the support groups. Private funders have also supported the Senior Expo, which is a wonderful thing. It's where seniors and caregivers come together with service providers. It is like it's a wonderful, happy kind of fair day, you might say, where everybody comes, they get their flu shot, they get to talk to all their friends they haven't seen in a while. John Commentary comes by and does interviews. It's a really sort of happy kind of event. So really, I would say one more thing about private funders. Private funders help pay for things like tablets that we can then teach older adults how to use, so that they can have visual connections with their family members.
Oh, that's really great. Are your needs the same going ahead, or do you have, what are your hopes for this next, time frame? What kind of needs do you have, and how can the community help you in those areas potentially?
The needs are the same. I think what we see at this point in the pandemic is that, there was a certain amount of need in the first 6 months, say, and then you take that and you add another 6 months to it, so it's compounded, and then you add another 6 months to it. So it's like the needs have intensified, actually. It's not that they have reduced, they have intensified. And it is all the same needs, absolutely. So any of those items that I talked about, we could use help with.
Oh, good. Well, I'm happy that you're able to share that, because there's always someone out there who might want to help with those particular areas. So excited that you and your community has been able to do all of these really great things. Thank you for sharing. Mary Beth, tell us a little bit more about how your organization is funded and what needs that you have going ahead, so people can support your organization.
Well, we are funded by insurances. So for our medical services, for home health, and for hospice care, we do bill insurances. But with that being said, there are people who are underinsured or not insured that we do not refuse service to anybody for the inability to pay. So a lot of our fundraising and the phenomenal work our foundation does with events in the community. Unfortunately, we haven't been able to hold a lot of events. We were hoping to hold our annual charity regatta, which comes up in September. We were looking forward to having that in person, but that's not going to be. That's one of our big fundraising events. And there's also a beautiful event around Mother's Day, for Mother's Day luncheon. But the foundation writes for grants, does fundraising events, and that help to support the programs for underinsured, again, or that are, or say underinsured or for not insured. One of the areas that a lot of the foundation raises money for is for our Serenity House, or the hospice house. Also, I think I mentioned earlier, the loan closet is supported by the foundation as well. So that sometimes they're buying equipment. There's obviously staff who work in there every day, Monday through Friday. So needs for the future, everything. We need everything.
Don't we all? What are some of those critical areas that would move the needle?
Oh, I'm trying to think.
Do you need more of that loan closet type equipment?
Well, loan closet equipment is always welcomed. We love that because there are some pieces of equipment that are a little bit more higher needs than others. Some things are very expensive. Learned how expensive a wheelchair is. A wheelchair doesn't cost $100. It costs several hundreds of dollars. There's a lot of that equipment. So equipment is always needed in the loan closet. Some of the bigger ticket items. Again, there is just always a need for things. When we have special programs, like even our telehealth program is actually funded by some grants. And I'm always bugging the foundation. If we need something, I can say, oh, maybe you guys can raise some money for us, So sometimes our special programs, we've had some phenomenal things done with it. We have a music therapy program in the hospice program. There's some alternate therapies that they do as well, like Reiki and aromatherapy. And there's, special programs like that have to be funded from somewhere. And that's usually what the foundation is there to help us out with. So then we have, I didn't mention earlier, a fabulous group of volunteers that work through the hospice program. And they in and as of a group, do a lot of great things together. They do special things all throughout the year. Lately, they've been crocheting blankets or making like small like Afghans and things for people, which is so nice because reaching out to people during this time has been so important. It's just, again, for people who can't have their family or loved ones, or they're seeing their people over Zoom or their FaceTime. It's just not the same.
Do you need more volunteers in that capacity?
Yes, always need volunteers. And they've also been doing some of the things like Lisa mentioned, reaching out, doing phone calls, having touch points with people, maybe once a week or whatever, because our volunteers weren't going in the homes as much either for, with lessening exposure. So there's clerical, administrative things to do. There's patient tasks. So there's always a need for volunteers.
And how should people reach out on that front if they're willing to volunteer?
Well, through the website, there is definitely a link on there to do that. Or if they do want to call our main number, if that's easier for some people, the 965-5555, they can ask for the volunteer coordinator and they would get in touch with them and they can do everything over the phone, get information, and they do Zoom calls.
Beautiful. Well, thank you so much, Mary Beth. Oh my goodness. Thank you, Lisa Brabo. Thank you for being a light for our community during such a challenging time. It is so important to be able to give these services to our community. Is there anything else that you would like to share before we wrap up and talk about our next show here? Lisa, do you want to go first?
Sure. I would just say thank you to the community for all the support that they've provided for our agency and the people that we're working with. One of the great things about being in Santa Barbara County during this entire time has been the support of the community. We're incredibly grateful.
Wonderful. Well, I am grateful for the two of you. Mary Beth, anything else that you want to share before we wrap up?
Yeah, well, I think it's the second, what Lisa said too, this community is amazing. We know we are rich in nonprofits and, I feel privileged to be able to be part of VNA and some other nonprofits I volunteer with. And I'm so happy that we can serve the community and they support us.
I'm so thankful for that too. Beautiful stuff. Thank you, ladies. Emily, back to you. Tell us about what's happening next week and any questions that either have come in or anything that you want to share on the independent side.
Yeah, so something that actually inspired the topic of this conversation is that the Independent just published an active aging guide in this week's issue. And there are stories on both Family Service Agency and VNA Health. So we encourage you to pick that up. It's tucked right inside the regular paper. So you pick up an issue, you'll have one with you. And it's also online on independent.com. So if this was interesting, I highly, highly encourage you guys to pick that up. And for next week's show, we are switching gears a little bit and we are talking about downtown outdoor markets. So Eric from downtown Santa Barbara will be on the call and he will be hosting the conversation with me and we will be talking to Sam Edelman from the Santa Barbara Farmers Market, Lisa Green from Blissful Boutiques, and Amy Gudino from downtown Santa Barbara. So it's going to be a good conversation. And you can sign up on independent.com/spotlight. And you can also find all of the other recordings of previous episodes on there and downtownsb.org.
Awesome. Can I share one more thing, Emily?
Yeah.
Excellent. So today is our State Street Promenade Market again, every Thursday from 3 to 7:30. Today we have a special treat talking about active aging. There is a really phenomenal group, World Dance for Humanity. They have been dancing on Zoom with people all over the world, keeping them fit and active. And today they're going to be doing a performance/class on State Street at 6 o'clock and afterwards. So if you want to come out and learn about this organization, how you can get involved and dance and stay healthy, this is a really good organization to do it with. So that's World Dance for Humanity. I think you can find them certainly on websites at worlddanceforhumanity.org, I think. Maybe don't quote me on that. I don't have that right in front of me. But yes, so much happening downtown. Again, you can always check out more about our local businesses on our website at downtownsb.org. You can find all of our various itineraries and neighborhoods, as well as individual businesses on our website. So we will see you next week. And then until then, thank you so much, ladies. Keep up the good work. I commend you for all of that you've been doing, and thank you.
Thank you.
All right, see you guys. Bye-bye.
Bye, everyone.